The Africa Centre for Diseases Control and Prevention says it will soon declare the Mpox outbreak a public health emergency. The agency's director said he was very alarmed by infection rates that have now risen by 160% in the last year. And for more on this, let's now welcome Professor Tulio de Oliveira, who is the director of the Centre for Epidemic Response as well as Innovation. Prof, great having you with us this afternoon. Welcome. So concerning, right, is the spread of Mpox. Let's first understand what this disease actually is and how it is actually spread, just for cautionary purposes.
Okay. Yeah, first, good afternoon and happy Women's Day to everyone. Yeah, so Mpox, it's an old disease. Yeah, it has been circulating in Africa for 100 and more years. Yeah. And then since 2022, it emerged as two new clades. What it means, the virus evolved twice. The first time it caused an infection around the globe on men who has sex with men. And the second time is what happened in the Eastern Democratic Republic of Congo. That's now start transmitting across the borders between Rwanda, Uganda, and Democratic Republic of Congo, and caused over 20,000 infections and more than 1,000 deaths in the last year alone. And the main way of transmission, it seems to be sexual transmission.
Very interesting indeed. So, Prof, who then, I know you mentioned it's usually amongst males who have sex with other males, but who is more susceptible or at risk of being infected? And is there a common trend or factors where the infections actually take an upsurge? For example, issues like socioeconomic backgrounds as well as reasons?
Okay, so what we know, there is two epidemics of Mpox. The first one is with men who have sex with men, which we had around 24 cases in South Africa. And the second one is what currently happened in the Democratic Republic of Congo, Rwanda, and Uganda. And that one is in heterosexual population. This means mixing 50% of the infections is women and 50% is men. And that is the new emergence that it's causing the epidemic between men and women, which the Africa CDC and the World Health Organization is very worried because it can affect a much higher population.
Now, Prof, it says here that, of course, the agency's director said they were alarmed by these infections and there's a call to declare this as an outbreak, like a public health emergency. How does then the Centre for Epidemic Response as well as Innovation go about proclaiming something if it is such a threat like a public health emergency?
Okay, thank you. Last week I was in Brazil with both the Director General of the Africa CDC, Dr. Jan Kaseya, and Dr. Mike Ryan, the Deputy Director General of the World Health Organization. And they were discussing about the worrying numbers of Mpox cases in Africa. If you declare a public health emergency, the main objective is try to release more resources to fight. At the moment, we do not have access to vaccines in Africa and very little of the treatment. And one of the objectives of that is to get more urgency and to get access to both the therapy and also vaccines to try to stop this large outbreak that's happening in the Eastern DRC and start to spreading to other countries.
Very interesting there, Professor, when it comes to the issues of treatment as well as vaccines. I mean, how is South Africa then currently dealing with managing some of the outbreaks as well as infections in the country if we do not have those vaccines as well as treatment that is readily available for those that might come across or be infected?
Okay, first, the outbreak in South Africa is very small, We have 24 cases, And for that, the Department of Health did got access to a few hundred vaccines, and treatment. The one that we are worried about, scientists, and public health officials, is the one that happened in Central East Africa, because that we are talking about 20,000 detected infections. And for example, there, the Africa CDC estimates that the Democratic Republic of Congo would need around 3 million vaccine doses. And for that, less than 50,000 were made available.
Thank you so much for your input this afternoon, Prof. I don't know if I still have time, but I think we've run out of time. But thank you so much for your contributions this afternoon. So basically, there needs to be quite a closer monitoring there at borders as well as ports of entry. I was talking there to Professor Tulio de Oliveira, who is the Syria director there on the rise of Mpox cases across the African continent.